Is the United States number one? Yeah, we are. We have the most powerful military on the entire planet. We have the largest economy in the world. We're number one. We're number one. And the United States has the highest incarceration rate and the largest total prison population in the entire world. Drug offenses are the leading cause of arrest in the United States. But for what? What has the war on drugs achieved? These laws and policies that are in place are designed to be tough on people who use and sell drugs. They have helped fill our jails and prisons, branded otherwise law-abiding citizens as criminals, and seen a rise in drug-related deaths. I have had close family members become addicts lost in the prison system, and only by sheer force of will and determination did they find sobriety and get back the life that they deserve. I have educated myself furthermore by reading reports from the FBI, the Prison Policy Initiative, and studying the outcome of Portugal's drug decriminalization efforts. Today, I am going to persuade you that it is better for society if we decriminalize the sale and personal use of drugs. First, I'm going to explain why drug arrests are rooted in racism. Secondly, I will discuss why decriminalizing drug use and possession will help prevent the spread of disease. And lastly, I will explain how it will free up resources like police, prisons, and court systems. The 2017 FBI arrest report states that 86% of arrests were for possession. With more light being shed on the systemic racism in the United States, it's now become more apparent of the racial inequalities our fellow Americans face. African Americans have the highest rate of arrests in the United States. According to the Federal Bureau of Prisons, Black Americans make up 40% of the entire prison population, despite representing only 13% of U.S. residents. High policing of Black neighborhoods and racially profiled traffic stops led to a high proportion of arrests for possession of small quantities of drugs. People in power have weaponized the war on drugs against minorities. John L. Rickman, who was Richard Nixon's assistant for domestic affairs, was quoted as saying, "The Nixon campaign in 1968 had two enemies, the anti-war left and Black people. We knew we couldn't make it illegal to be either against the war or Blacks, but by getting the public to associate hippies with marijuana and Blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Of course we did." Now that we understand how arrests are rooted in racism, let's talk about how decriminalization can stop the spread of disease. Syringe injectable drugs have caused an increase in overdose deaths and disease. Diseases can spread through injection use if people share used needles or syringes from an infected person. Some diseases that can be transmitted are viral hepatitis, HIV, and other bloodborne pathogens. According to the CDC, there has been a 3.5 increase in new hepatitis C infections directly linked to injection abuse. The same article states that it costs the U.S. $15 billion annually to treat those infected with hepatitis C. Syringe service programs, or SSPs, are a proven effective program that offers disposal of syringes, vaccinations, HIV testing, and sepsis abuse treatment. The CDC reports that the use of SSPs reduces HIV and HCV by 50%. People who inject drugs are 5 times more likely to enter treatment if given the option with SSP. This means that the people who want help have the access to do so. Unfortunately, SSPs are not available nationwide. Portugal has already had great success with this. In 2001, they decriminalized the personal use of drugs. Drug dealers still go to prison, but if anyone is caught with less than a 10-day supply of drugs, is typically sent to a commission consisting of a doctor, a social worker, and a lawyer. Reported by Time magazine, this has led to a significant drop in HIV cases, from 104 cases per million to 4 cases per million. By eliminating the threat of imprisonment, people in drug treatment increased 60%. I've talked about racism and the spread of disease. Now let's move on to the next main point. Drug decriminalization will free up vital resources like police, prison systems, and court systems. Police respond to a high number of emergency calls every day. Yet the drug-related stops and arrests frequently take time and manpower away from more serious crimes. Funding is a concern as well. Yet the U.S. already spends $47 billion annually enforcing drug prohibition. 1 in 5 people are incarcerated for a drug offense, according to the Drug Policy Alliance. And less than 1% of prisons and jails offer medications to help with addiction treatments. It is less likely that a person will find sobriety in prison rather than a rehab facility. Our court systems are also overfilled with drug-related cases. People who are arrested cannot afford bail stay in jail until their trial. 1 in 4 people who go to jail will be arrested again within a year, according to the Prison Policy Initiative. These arrests take up valuable court time and taxpayer money. Today, I first explained how drug arrests are rooted in racism. Second, I told you how decriminalization can help stop the spread of disease. And lastly, we talked about how decriminalization will free up vital community resources. It is better for society to decriminalize the sale and personal use of drugs. In conclusion, there is no perfect answer to our nation's current drug epidemic. But what I think we can agree is that what we've been doing isn't working, and it's time for a change. It's time to help our fellow Americans and address this health crisis. Thank you.